and forget to record. But it's so wonderful to be with you all. It's great to see so many of you, so many familiar faces, some of whom I haven't seen in a while. So hello. Welcome to the February 2025 CTIPP CAN call. And I will pull up the slides that will help orient at least the beginning of our conversation with each other. And so for today, we're gonna work on what we're calling co-creating an ideal agenda for the trauma-informed movement. And we look forward to all of your ideas about what should be included. There will be time for individual process. There will be time for breakout rooms and connection. I will say if anybody is not in a place where they can go into a breakout room, please let me know and we will honor that as best as we can, but we're not going to do that just yet. So feel free to message me. If you don't want to go into a breakout room, you will have an elongated opportunity for independent reflection before we do some group activity there. And we're going to use this information at CTIPP as we continue to develop our agenda as an organization moving forward with hopes of helping to lead the movement across various advocacy opportunities. I'll share a quick story about why this is important to me at a personal level, if that's all right. But when I was in college, college for me started pretty well, and then I got into I lost sight of like the baseball and studying sides of college that really kept me centered, and got into I'll call it too much of a partying sort of atmosphere that distracted me from a lot of what was helping me be successful early on in my college career. Some of you have probably heard me talk about this before, but one of the things that one of my big traumas when I was in college was that I got arrested for something that I didn't do, which really sparked off a lot of that self-destructive behavior that kind of perpetuated for the better part of my junior year of college, about 9 months, where I was pretty lost, I would say, in terms of what was going to make me successful, the reasons that I went to college. And one day during my junior year, playing baseball before the game, teammate had an errant throw during warm-ups that hit me in the head. And I got a pretty bad concussion. And during that time, if anybody's ever had a concussion, which I hope you have not, you have to isolate. You can't really use technology. It was not my first concussion, and so we took it pretty seriously. And so I was isolating in my room and essentially forced to, for the first time since the arrest, really grapple with how I had allowed my life to spiral and how my life had spiraled in so many directions. And when after the first time is an interesting thing when you're concussed in an isolated dark room. So, what feels like the first few days of probably wallowing led to what I'll call a radical acceptance of what had become in my life to that point, and how so many of my hopes and dreams about baseball, about potentially going to law school, were not going to be possibilities because of what I had allowed to happen and what had happened over the majority of my junior year. And that was really difficult to grapple with, that reality. But coming out of that, I just in that space of radical acceptance, I kind of started to allow myself to dream really, really big about what I wanted my life to become, not hampered by the realities of what I had accepted and kind of where I was with my life. And through that process, I just to be like fully transparent, I was dreaming about being the president of the United States and being able to spread policies. I had come up with this personal mission statement to create a sustainable planet and a better future for all that has honestly guided me since then. But more than just that big, ambitious dream, it was a function of then taking the reality of what my life had become and having that big, ambitious dream that I was going to chase as best as I could. And I wrote a story about how I could get there, which I am 10 years past that time in my life. I am now 31. I was 20 at the time. So 11 years past. And uh, I'm like maybe 5 to 10% of the story like was even close to accurate. Like most of it was just a work of fiction, right? But in the process of allowing myself to dream, it started to move me through a process that enabled me to feel less stuck than I had felt for so long, right? What was really driving the behaviors and the habits that were leading to the downward spiral that I had to grapple with, I started to be able to dream big. And so that is not entirely related to developing an ideal agenda on a policy side in a lot of ways. But this idea of being able to dream big, right? And the power that coming together and sharing in those dreams and the hopes that we have for what drives us to that movement it feels really important right now. And I just wanted to share that piece of why this feels so important at a personal level with you all as we enter into the call, which if it doesn't make any sense and it was just me sharing a part of myself, that is okay. Hopefully, it also connects to this idea of us coming together and dreaming together about a big and ideal agenda for the trauma-informed movement that, again, as we move forward in time, we will find the strategic opportunities and the points that we can leverage to make specific policy changes, because we won't be able to pass one whole big ideal agenda all at once, at least not in the current context of the political environments that we are living in. But let's take time to dream together today, I hope. And I hope that that's valuable and helps. I know that it will be valuable for us. And so I appreciate your A, listening, B, participation in this call, and C, the wonderful ideas that you bring and the experiences that you bring into this call with you. So thank you to Laura, who found this adorable graphic. For all that I know, she created it. But we want to start by addressing the elephant in our virtual room, which is that the first month of this administration has been disruptive, as it promised to be, which has created instability and stress for so many people within our network in so many different ways. And we just want to create space for that and hold that. The threat to pause federal contracts and grants that threaten the livelihoods and work of so many colleagues was incredibly impactful. The inclusion of the word trauma itself, in addition to many other words that are relevant to our work, as red flags for National Science Foundation's grants, threatens ongoing research funding and support for work across our movement. And I could continue with this list, but I think that we all get the point, and I want to be mindful of not re-traumatizing and reliving all of what we have experienced by continuing to lay out the threats that we're facing. But we just wanted to take a moment to recognize that there are many actions that are impacting many folks in many ways across our movement. And we wanted to start with an acknowledgement of that fact as we move into, again, the big dreaming that we are going to get to. Usually, if we do this at all, we have some sort of a presencing skill that is embedded in the middle of all of the content. But given all that's going on in the first month of this administration and how it might be impacting people in the movement, before we get into our work together, we wanted to create space for some presencing skills and purposing skills to start the call together as we come to each other for our friends over on the other side of the pond at 7 o'clock at night. It's already been a long day. For us on the East Coast, it's 2 p.m. It's been a decently long day. For our friends on the West Coast, it's 11. Still been a fair amount of day that's happened. And so presencing skills and purposing skills are part of our work with transformational resilience coordinating networks that we know help to build regulation and coping through adversity that helps us use adversity as growth opportunities. And so we wanted to highlight these very quickly and go through them together. So presencing skills are, as you can see, the knowledge that we can manage our body, mind, emotions, and behavior that can provide tremendous confidence in facing present day adversities. This helps to build self-efficacy. And then purposing skills help us find meaning, direction, courage, and healthy hope to intensify the pull of purpose or adversity-based growth skills. And so there are a number of different presencing skills that I'm sure that all of us know. I invite folks to do whatever feels best for them. I will just invite a few deep belly breaths where we just breathe really deeply and mindfully into, a good full breath, not just in our lungs and puffing our chest, but really into our bellies. But again, if you have a preferred breathing exercise or mindfulness exercise that you would like to do as a presencing skill right now, I invite that, and we'll take just a few seconds for some good deep breaths together. All right. And then for purposing skills, we will do something else, but just to spell out something else that has been on my mind. At the beginning of President Trump's first term, I was working in a high school in Philadelphia that had a significant population of students with autism that I worked with. And I remember that there were some very challenging conversations where some of them were impacted by the results of the election because of when he had mocked a reporter with disabilities during the campaign. And the takeaway for a lot of them that was shared by some of the students was this country doesn't care about us. And I just couldn't deny their reality. I couldn't tell them, like, I told them how much I cared, but I could show them that I cared and that a lot of people did. But I couldn't, I just had to learn from that uncomfortable fact of what they were learning. And I know that I have shared with our network before my work to coach a group of students with autism at that school in presenting to the student body and faculty advocating for inclusion at that year's Black History Month assembly, which I have been reflecting on a lot lately. So taking that discomfort and moving into our spheres of influence and moving toward advocacy and using our stories to make a change within our loci of control, to me, is a really good example of purposing skills. For us on this call, let's take a minute here just to reflect on how, given the adversities that we have discussed on this call and others that we are facing, how we want to move forward in advancing our movement. Can we think back to other times that we overcame pushback and changed people's hearts and minds who at first resisted a belief that we held strongly? Think back on that time. And we're going to take a minute here to reflect about what you've done in the past, what we want to do moving forward, or any combination of the two, and knowing what we will get to if there are some pieces of policies or practices that we want to advocate for that we are already thinking about bringing into this call for developing an ideal agenda. And so know that this practice is something that you can come back to, and we'll just take about a minute to reflect individually on what we would like to do. If you all are still reflecting, by all means, please continue to do so. Don't let me interrupt that. But we'll get to what we're going to get to in today's call. So first, coming off of the purposing skill and in the context of what we discussed earlier on this call, there are some very serious threats our movement is currently facing. Thinking about the knowledge that we mobilize around, we know that this level of stress does things to our minds and our bodies. It's understandable to fall into a scarcity mindset and think short term rather than long term strategy. We know that that is something that happens to the mind when it is under stress. This is a strategy that is used as psychological warfare of sorts to sow division into movements, right? And so we want to go through those regulating activities. The reason that we put that early on is that as much as we can be mindful of how we can promote our own regulation, we can work around the strategies that are used to divide us and force us into short-term thinking while other people are operationalizing long-term strategies. It also, we know, forces or can create isolation within us. And an antidote to that isolation that so many experience in efforts like this is by us coming together, which we want to, again, use this call as an opportunity for. An example of this in practice was a workshop that I facilitated with my friend Jared with a partner organization that I met through CTIPP in a red state where they were facing burnout in their advocacy, the scarcity that they were up against in terms of policies to promote well-being of children, families, and communities was so great that for many years they had worked isolated to largely defend policies that were already in place more than they were able to promote new and better protections because of those political realities, which seemed to only further increase burnout. This situation was not isolated to the state that we were working in. There are many advocacy groups in many states, both red and blue, that resonate with this, as there is frustration that is shared widely. But by highlighting during that day-long meeting what drives the forces beyond what we see and hear on a day-to-day basis. For example, highlighting what drives many of the conspiracies that create either false resistance to the good policies folks advocate for and or distract from advancing new policies by generating culture war debates that enhance division rather than advancing where the vast majority of American people agree. We were able to work with folks in the room to better understand what was happening and where we were able to connect with each other in the common struggle that folks were facing, again, creating that united movement. We did this over the course of a full day. So in this CTIPP CAN call, we will not be able to replicate all of that on this call, but we hope to make some progress together in building that big tent coalition like we did that day. Moving beyond the isolation and scarcity of possibilities, we ended the day together by creating what we called an ideal agenda, what our ultimate agenda is going to be for this call today. We dreamt together about all of the policies and practices that we would like to see. And in doing so, we saw a tremendous amount of overlap in interest among advocates in the room that became more apparent than when we entered into the room. And folks were able to come together around what was possible, and therefore the coalition strengthened. Just to say before I stop with this example, I am purposely de-identifying anybody that was involved in that, but I am so grateful for the advocates and organizations who shared their time and expertise with us that day. And I am grateful for all of you who are sharing your time and expertise with us today. While we are virtual in this CTIPP CAN call and together for a shorter period of time, we wanted to build and start to promote that idea for an ideal agenda. And what we come up with today, again, will inform our ongoing work to develop an agenda to drive the trauma-informed movement forward in the present as we continue to grow. I will quickly share before we get into the other parts of the call that we have we just launched our first ever fundraising campaign to try and promote opportunities for shared advocacy for the trauma-informed movement. What we are trying to fundraise for is an opportunity, and this is an opportunity that is open to all of you to be able to use advocacy software that we purchase as CTIPP, because that can be prohibitively expensive, to mobilize around policies that you see as critical for the trauma-informed movement. There is a process to apply there that I am about to put in the chat, along with the link to Amplify 2025. I just saw Go Birds in the chat when I put that in. Go Birds. I love seeing that. But we wanted to share that if you want to drive forward on an advocacy issue in your community or at your state level, Quorum, the software that we have, is really only beneficial at a government level. So while we encourage other forms of advocacy, this won't necessarily work if you're advocating for an organization to take up a new practice. But if there's a policy at a local, state, or federal level that you want to see, there is a process that you all can submit to be able to leverage our software infrastructure, as we want to serve as a good intermediary for the movement as it continues to grow. And if you are in a position where you are able to contribute to our Amplify 2025 campaign, there is a link on in the chat for that as well. And I just want to say that it means so much as we continue to develop resources for advocates at all levels, for all of those who are able to contribute in whatever way you can, whether that is monetary, whether that is sharing the campaign, or whether that is taking part in using the technology that we are using to share and spread and grow this movement. And just to mention, while we're doing this as a nonprofit fundraising campaign, just to say very explicitly, if you cannot donate, we still want you to use the software, right? The software is not a pay for play. It is open whether you can donate or not, regardless of capacity. That's where we want to come in and provide a service to the movement. But we also want to do fundraising around it to be able to sustain that support that we are providing. Okay. So we are about to get into where I will stop talking. I know that I've been up here for a while at this point, rambling in the best, most loving way that I possibly can. And we want to share in the chat again. I just shared underneath the last share about Amplify 2025, a link to our vision, because we're not starting from scratch here, right? We know that there has been so much work, so many policies and practices that have already been part of the trauma-informed movement. And we have done our best to date to use that in informing the CTIPP vision that I put in the chat, which spans 16 dimensions of society, from the time that someone, really before someone's born. How do we create healthy communities and healthy families to enable them to grow and thrive and succeed in life, as well as every system that someone touches throughout their lives until the end of life? How do we take care of those at the end of their lives? And bereavement care, how do we take care of those that are left behind? Trying to create, as best as we could, a comprehensive vision of what a truly trauma-informed society could look like. This vision is shaped by the 6 principles from SAMHSA of a trauma-informed approach, and it leverages existing policies that have been introduced. We actually have an intern that is currently going through and working to highlight where there are policy examples underneath. If you click into the vision, any of the bullet points that you see within any of those dimensions, we have an intern who is currently going through to highlight real policy examples that we can add to this vision. So if you're interested in moving something forward, you can draw out where there has been a policy that has already been introduced, using that as precedent. There are also practices that we have found through research. This was work from Whitney Maris, who used to be a member of our team. And she, in doing a lot of research through what was moving in the trauma-informed movement, there are also a number of different practice examples that have been introduced. And we have, since introducing this, been trying to collect wisdom and insight into what we can do to make this vision better, what we are missing. And so that is a big part of what we are trying to do here today. But I wanted to share that for you all to be able to leverage and think about, because we are not necessarily starting from scratch. in this work that we are doing today together. But there is also, I recognize, a lot of room for growth within the movement, right? This is just a place to start. This is not the ending point by any stretch of the imagination. And so we want to do a collective brainstorm in our time together. Right now, we're going to take 5 minutes for some independent reflection where you can go through the vision without me talking to you about the vision, and then also take any notes on what you want to see introduced. It doesn't need to be so grandiose. It can be very specific into your area of expertise or your area of lived expertise and interest that you're most passionate about, or it can be for the trauma-informed movement as a whole, right? There's really no right or wrong way to go about this. We want for you all to have some time for independent reflection, and then we're going to go into breakout rooms. So like I said before, if you want to be on this call, want to take part in the broader group discussion that is going to take place after the breakout rooms, but don't want to take part in a breakout room and would prefer a long form independent reflection time, please send me a chat right now, because while we're doing the 5 minutes of independent reflection, I'm going to go ahead and make the breakout rooms for us. And so if you don't want to be part of a breakout room, I will put you into a separate breakout room with folks who don't want to be part of a breakout room. And so just wanted to say that I will actually stop talking now for about 5 minutes. So at about 32, I'll come back. We'll go through some community agreements, and then we'll go into breakout rooms together. So next 5 minutes for thinking. Appreciate that, Vicky. Welcome back, everyone, from breakout rooms. I know that someone, at least one person, perhaps six, were interrupted in the middle of saying a brilliant thing, and it always happens. I wish that there was like, AI, in case Zoom AI is listening to us right now, like if AI could come up with a smarter feature that allows for someone to finish their comment and then like finish the breakout room there, that would just be wonderful. So I'll just put that out into the universe for us to have. But thrilled and looking forward to hearing folks' thoughts on what was discussed in the breakout rooms, what folks independently reflected on, what do we want to see as parts of the ideal agenda for the trauma-informed movement. I have certainly spoken enough and opened it up to this group to share. Again, no right or wrong. Yeah, please, Inga. Thank you.
You're welcome. Um, we were talking about the fact, well, let me go into a little backstory. I was very curious at the beginning of COVID about what our public officials were going to do about the behavioral health needs that we know were going to happen, and the crisis that we know has happened and is still happening with our kids. And nobody could answer the question. There's nothing being done. And so we started a group called Trauma Responsive Frederick, which is where I live, Frederick, Maryland. And because grassroots had to do it, nobody else was doing it. And so one of the things that we talked about was the need to do a campaign, a grassroots campaign to educate, if you want to, regions, jurisdictions, whatever you want to call it, about how to move the needle forward. Because I'm finding out in our case, we've been around since 2020, that we have to bring our government officials along with us. They have nothing to offer on this. So we have to bring them along with us. So, yeah.
Appreciate you very much for sharing. Thank you. And absolutely. Just want to highlight from the chat, theme from our group was the need for community outreach to help people access available resources. People aren't aware of programs that are available. Focus on grassroots outreach because resources won't come from government, bigger organizations. Sounds very, very similar and aligned. So appreciate that. If folks are more comfortable sharing in the chat, by all means, please do. And if you would prefer me to not read it out loud, feel free to write that in the chat message, and I will honor that. Vicky.
Thanks, Jesse. Good to see you again. I just looked quickly at some components in the vision, and I also want to make sure that we're focusing on developing trauma-informed workplaces. We work on training organizations, mostly social services, human services organizations, on how to be more trauma-informed and resilience building. Initially started that work saying, how can you be more trauma informed for the participants that you work with? Quickly got corrected by the people, the staff doing the work, saying, yo, what about my trauma and toxic stress that I face in this organization from this organization's policies and funding cuts and changes? And so we've been also focusing on the trauma of the staff in nonprofit organizations, education and training organizations, and even private sector, like in construction, building trades, because trauma and toxic stress lead to accidents that OSHA does not like. So I was looking at things like the components in the vision around expanding a trauma-informed healing-centered workforce, but I just want to make sure we're also including workplaces. Also the one around governments, foster accountable, trauma-responsive local, state, and federal governments. And right now, most of it seems to be looking at it through the lens of, helping people who receive government services, but not necessarily the people who work in government, especially now with all the federal firings. That's a lot of trauma. And then the one on schools, cultivating well-being and resilience in schools. A lot of what we see is focus on the kids and their trauma, but teachers and educational staff have also been experiencing a lot of trauma and toxic stress. So how do we help the people who are helping the people? That's what I want to make sure it gets included in this vision as well.
Really appreciate that, Vicky. You got a lot of hearts and nods as you were talking there. So yeah, appreciate that call out. That's wonderful. And Lisa.
Hold on. Trying to see if I'm on. I'm on. Okay. I just wanted to, I was in the room with Inga and just wanted to add, that we're at so many different levels, and I'm in Michigan, so we're Michigan ACE initiative, and we started at the grassroots level instead of starting at the top down, and we've had pretty good success. We started our 9th year in December. It's tough, like everybody, to find funding. We've had different funding. We started out with a 2-year grant. We got off the 2-year grant. We were able to get some funding from one of our old health plan members. Actually, they sold their health plan, but they were willing to invest in this. And then since then, we've been piecing together, but we've trained interstate. Our initiatives trained 7 cohorts of master trainers through ACE Interface. And there are 2 other ones that I was indirectly involved in one, and the first one, not at all. So we have 9 cohorts. So we have 190 plus master trainers, and the Michigan ACE initiative built out what the Train the Trainer program. So we call them Michigan ACE Community Champions. So they are trained to go into their communities or schools or wherever, their church, wherever, and be able and confident to talk about ACEs, and then also need to supply that support system around when those conversations happen, like having a counselor or somebody that if somebody's triggered. So we started this work in 2017, and it's a lot. It's a lot to take on, and it's a lot to get to the point where, so when Inga was talking about funding and starting at grassroots, we started at grassroots, and we are just getting to the point where we are now requesting statewide funding for all schools to do ACEs training for school staff, meaning the teachers, the janitors, the bus drivers, the people that work in the cafeteria. And our governor has done some wonderful stuff on social determinants of health and a lot of mental health supports in the schools. Right now, there's a lot of focus on training those mental health providers because they don't understand it. But without having that connection of our school teachers and those people that interface with the students every day and being able to connect them to the needed resources, I just don't see that there's that connection. So we're working on getting funding for one, and we've merged with the with the work that was gained through 2 CDC contracts, grants, and right now we're in Essentials for Childhood with our Michigan Public Health Institute. And so we have an actual place to say, we've built this and we can cater to each school's specific needs, because some are already training and some are already doing this work. And so then the question is, well, you mandate this, what about the ones that are already doing it? Well, we can provide toolkits and we can provide, more specific help, or maybe individual grants to help them in their own communities. So we've taken it from like a grassroots, and now we're working from the top down and hopefully bringing it all together to make it cohesive across the state. And I tell you, it doesn't happen in a year or two. It's been, like I said, we're in our 9th year. So I just wanted to, to put that out there that, yeah, there's a lot of different ways to approach it. And, but the most valuable asset I've ever had was when I recruited those trainers from each individual portion of the state. We would start with portions in like 3 or 4 counties. And that was so valuable. And those people that get trained need to connect to their local legislator and start creating that awareness, and it'll just start to snowball, hopefully.
Appreciate you sharing that, Lisa. You've got a few comments in the chat, and a lot of what you shared resonates off of what Vicky was sharing too, about, needing to do more than just the social, like creating full environments, right? And then you sharing how you built momentum is really, really valuable. Would love to stay connected as you all continue to move out and learn from what you're learning. I see Sharon's got her hand up. Elisa, please.
I'm going to take your opportunity for your platform, your advocacy platform, and add that to our political ask right now. I need to take it to my policy work group and my advisory council, but I'm hoping by May that we can do an all-out campaign, because I know that will really help versus me having 4 or 5 people or some multi-client lobbyists, targeting a legislator here and there.
We're glad that that's
looking forward to that.
Yeah, I just put it in the chat in case that's helpful and for anybody that wants to reference that, but appreciate that so much, Lisa, and all the work you do. Thank you for sharing. And Sharon.
Jesse, good to see you.
You too, Sharon.
I would like to see somewhere in all the goals and objectives facts to show how cost-effective trauma-informed care is, and that it impacts all the things that we're talking about. It impacts mental health and addiction services. Back to Tarpon Springs, I mean, many years ago, that's what sold their program, is when they can show how it reduced crime. And I think if we could really have just the facts and take the facts to the legislators and do it as quickly as possible, because the money has been frozen for grants. It hasn't been taken away yet. And from what I'm hearing, the loudest voice is the one that's going to be getting the money. So if we want to continue, it seems to be, we all know it works. We wouldn't be here. But how can we make people that don't know that and meet them where they're at? And right now where they're at is money. Let's show them how much money it saves a community, an organization. I was talking about licensure boards, massage therapists, barbers, hairdressers. They all have people that come in and tell them their traumatic stories. What about them? So I think if we expand this idea of workforce beyond social service agencies, beyond schools, but we have to sustain ourselves and we need money to do that. So how do we get money? Through grants and fundraisers. But people want to know, what are the facts? Why do I want to give money to you? And I think sometimes in being so social service oriented, we don't focus on the fiscal part enough. And I would just love to see that. And I think maybe collectively we could get those facts together. Thanks, that's all.
Thank you, Sharon. Thank you for sharing. If anybody's got facts that back up what Sharon's saying and we can make the economic argument, like, please send them, right? And that's huge. At the expense of not seeing any other hands right now. And please, if you've got more ideas, put a hand up, but I will quickly, never mind what I had to say. Like I said, I have said.
Excuse me. For
Ally
some
and Gail.
reason I can't get in the chat. Okay. But
Ally, we'll get to
I have an organization that's called the Philadelphia Black Captains and Community Association. So one way we could get it together, I was just saying to a couple of Black captains, we need to do something in the communities. Your Black captains is your actual leaders. In my program, what we do is teach them. Right now, I have a program called Crusades to Save a Life. That's teaching Black captains and people and individuals in the communities prevention skills, first aid skills, safety skills, and mental health awareness. And I do it once a month at a different location since I launched the program in Philadelphia, and it's been very successful. And I give out a lot of resources after the class.
That's phenomenal, Gail. I appreciate that. And I am doing some work in Philly, so I will reach out to see if we can connect.
Yes, and I would love to join ACES for their training.
Right on. Appreciate that very much. And
Yeah.
all you shared and all that you do. Allie, I saw your hand up as well.
Hi everyone. I'm also from Philly. Hi Gail.
Hi.
We don't know each other, but now we do.
Yes.
This is my first meeting, so I just want to introduce myself. My name is Allie Huxa. I'm at the Center for Hunger-Free Communities at Drexel University, and I really appreciated our conversation. Inga, the stuff you were sharing about the Maryland Way, I feel like I'm gonna put you on the spot. If you could share that, that would be great. But also something that's happening in Philly that was getting some traction and has lost some just because of the new mayor is mobile crisis units. I'm not sure, and because I'm new, I don't know what we've already been working on, but mobile crisis units in lieu of police response. So I think I would want to advocate for that. And I also I don't know at what point we could talk about this, and I guess maybe if it's like a thumbs up or something. I'll say we were talking about this in our group. Is it I'm feeling personally and also in my community a collective freeze response around what's happening right now. There's just like too much, too fast. That's the strategy. I think it's working, sadly. And thinking about the grassroots, like we're saying, I think Inga made a good point in our group that like a lot of this stuff, if we can't trust federal funding, if we can't trust our federal government and the infrastructure to succeed and come through this moment, like it's gonna have to come from the grassroots. But I'm experiencing a freeze moment, and I'm like, my sister's in France, and she keeps being like, are they in the streets yet? Like, where is everybody? And just looking at like what we're here to do and what this group is here to do, I'm just curious at what point, if like, I don't know, I was curious if there was a moment to talk about that, because I'm thinking about like feeling activated to do work, and I'm feeling very frozen. So I just wanted to put that out there as far as like the feeling behind being an advocate right now is what's happening.
Appreciate that very much, Allie. And Welcome to your first CTIPP CAN call. Always a wonderful thing. Yeah, we did last year, September through December, trauma-informed advocacy trainings that we will bring back to create space specifically around how we model the model in advocacy, and hopefully continue. I don't know if that's touching exactly on what you suggested, but creating space for folks to that burnout, that stuckness that we all feel is really real. And there's a lot of reasons for feeling that, right? That again, don't want to say not to feel it, but coming together and being together in a space where we know that we're not in that alone, and we have groups that we can come back to share that frustration with, is some of the best that we can do as we continue to move forward, as well as develop shared understandings and methods to the advocacy that we're doing, right? In the success of the civil rights movement, that in addition to what was being advocated for, the method of advocacy itself was so powerful. The nonviolent communication method that was taught at a very high level nationally through institutes and then leveraged, created a lot of the power for the political pushes that we saw. And so we will bring that back. We'll try to get one up in the springtime. And then again, if there's something that is not hitting on, please let us know. Because we want to be here to provide the best resources and supports possible for the movement. And again, if someone's got a thought, put your hand up and I will stop. And Lisa, please.
Sorry, I've been at this for a while. One of the things that comes to mind is that when we first started doing this training, especially within our Department of Health and Human Services, people that have been working for a while, well, you're just reframing trauma, you know, and so they would just brush it off as it being reframing trauma. This is nothing new. But before, we did not have the data and we did not have the ACE study. So now we actually have evidence-based data showing these impacts. So that's your power right there. So when you get that pushback, you just need to develop and, like I said, focus on what the real issue is maybe in your community and make that your first focus instead of being all over and trying to cover all 10 ACEs. I would recommend showing, I love the Robert Woods Johnson Foundation graphic that shows the ACEs in the different, in the different pieces. Yeah, you know what I mean, Jesse?
Yeah.
And because it's so easy to look at, and then you can expand on that, and then maybe you can develop a paper that shows if you have data, it's great. The hospital needs assessment data is a good place. For us, it's tough sometimes to get the YRBS, which is the Youth Behavioral Health Assessment, or what we call the MyFi, which is voluntary in our schools, which makes things really hard. But that's another survey that they do among students. So whatever data that you can get in your county and where you can get it is really helpful, and tie it to that. And somebody just says you're just reforming trauma. Just keep going. Go to the next one. That's what we did. I'm sorry, it happens, and it's just something that we have to deal with.
Appreciate that, Lisa. For my Philly friends, I am working on a bill called the Love Act, Lowering Overdose and Violence Epidemics, that I won't go too far into, but would create neighborhood-led, like at a neighborhood level, community coalitions, and then create coordination and alignment in the city government. As I'm currently at Penn's Masters of Public Administration at their Institute of Government. And so while I'm in Philly, trying to move that bill forward to organize out of the managing director's office. And then rather than just doing like one thing for the whole city, it's like kind of like co-creating Kensington has done, create that neighborhood-led movement building that is based within trauma-informed approaches. So if there's any interest, I'm happy to discuss that further. And then, yeah, so many Philly friends on let's. And then to Sharon's point earlier, also just want to share that one of my, Gail, did you have?
Oh, no, I was trying to get in the chat to tell you, yes, I'm in, but I can't, for some reason, my chat is not opening, but
All
I'm
right.
good. Okay.
Right on. I got three folks from Philly that I will send an email to, and we'll connect. We know that the economics of this are so strong. One thing that I wanted to share in an ideal agenda from my perspective that's been a big part of my advocacy, and then want to continue to open it up. And I do not mean to dominate the call by any stretch. I just get very, very excited, which usually leads to me being talkative, which I will continue to process and work on a go forward. But we know that, so the way that so many things in our society are financed is through a project finance mechanism, where right now we essentially, I work in nonprofit development. This is not to demean anybody that works in the nonprofit space. This has been my entire career. But we so frequently, it feels like, have to beg for money, whether that be from philanthropy or government, that is oftentimes short-term money from folks that have shifting priorities, rather than being able to have a long-term strategy that is financed for us to build the infrastructure that we need. And project financing is an approach that in other parts of the economy, if we look at how energy systems are financed, it is through a project finance approach that, because we know that there is such a strong economic argument for the cost of ACEs in society, let alone trauma more broadly. But again, because ACEs are finite, they are, you can count them, and there is better data on the cost of ACEs, where if we reduce ACE prevalence in a population, we create cost avoidance for future budgets. Essentially, ACEs pose a risk for future budgets in a number of ways at a population level. Again, not at an individual level, not individually predictive, but at a population level, it's the best public health predictor that we have. And so if we can create a financing mechanism that allows for us to invest in building community capacity, capture the return on investment to then sustain and scale the initiatives that we're talking about, instead of needing to essentially beg for short-term grants to sustain and survive year to year. That's a big part of the advocacy that I am driving forward, that I call full capital. And so while we're putting out their dreams for an ideal agenda, I wanted to share that because I think that it fits into the current administration's want, or stated want, to create more effective and efficient government systems, as well as doing the work that we need to be able to do. I think that there is an opportunity to move that forward, irrespective of administrations, but just wanted to share that. What other thoughts while we're dreaming together? I see more chat activity that I missed, but if anybody's got any thoughts, please. Deb, I see. Yeah, please.
Okay, thank you, everyone. I'm Deb Berkey. I'm at Wilmington University, which is in Delaware, which is the lower Philadelphia area. So I could be part of the Philly crew too.
We'll count you in, Deb. Heck yeah.
I would love to see more usage of the 4 realms of ACEs. Not that adverse childhood experiences aren't important, but those are what occur within the family. And the 4 realms also take into account communities and environments and that kind of thing. I know my group also talked about emphasizing positive aspects or assets. And I wrote using the phrase at promise as opposed to at risk. Also, I have a pet peeve with the social determinants of health phrase, because that sounds like that things, so language is important, basically, is my point. And then I did put a couple of things in the chat too. I feel like it kind of struck me as us being siloed, because we've got universities and colleges doing work in this area. We've got professional national organizations doing work in this area, and we've got local grassroots organizations that may or may not have connections to these others, and that networking and bringing it together, which is also one of the things my group did talk about, was that one of the positives that may be coming out of what's happening now is people are reaching out and connecting and supporting one another. So that also kind of addresses somebody's comment about the fight, flight, freeze response that a lot of us are experiencing right now too, is if we can connect with others, then we can help each other address that response.
Absolutely. Thank you so much, Deb. And the Four Realms of Aces, for those who haven't seen, I don't know if, Deb, there's a different one other than Smart Starts from North Carolina that they use.
That's the current one. Mhm.
Yeah, but I know that that's a wonderful resource for folks if you haven't seen that before. Are all of these thoughts are wonderful. Are there other things? I'll get to 2 points in the chat that I see, but anybody else who wants to share right now? Anyone else feeling more immediately threatened by the current admin's directive to dismantle their trauma-informed care consortium work because of DEI? Our consortium is connected to a university who receives federal funding and is being told to shut down the TIC programming. Yeah, and we talked about how trauma is right now very, very much a word under attack. And again, I will say the opportunity that I see is if we can get movement on any bill or any part of that word, because that is the work of a particular think tank that it started with diversity, equity, inclusion, essentially for folks who work in the social emotional learning space. You know that SEL was brought into that, and then trauma-informed care was kind of in a generation of add-on words. And that span of words is what made up most of the, I think that it was 70 some words in the NSF grant, like red flag list that was there, right? And so we've been talking about that for a while. One of the opportunities that exists is to then anything that we can get that trauma is nonpartisan, which I think we all know it is, right? We are trying to hold space for everybody to improve the lives of everyone. We can defeat what is driving that. And also, I say that with a sincere recognition that that is a very real threat, right? And my hope doesn't necessarily reduce the threat for what it's exacting in our world right now. And so there needs to be coordinated strategy. Donald Trump signed into law in his first administration the Interagency Task Force on Trauma-Informed Care. There are Republican Congress people, far-right Republican Congress people, who support the importance of trauma and ACEs. And again, I think that there are opportunities to defeat a lot of what we are seeing there. And also, that's a very real threat. And I appreciate you bringing it up. I think that a lot of folks on the line are feeling that. The other piece in the chat, which was done a while ago and I missed it, which I apologize for, is someone talked about businesses really wanting to do ACE and trauma-informed care training for supermarket employees. But there is a lack of time for that training. And I would wonder if there is, like, that's very real, right? But if, especially at a supermarket, there's a way to host a dinner that the supermarket can get some benefit of, like donating some food to, and we'll put that on, right, in the workplace. It's just everybody in a community needs to have a stake in creating trauma-informed community. It can't just be on some of us. But where if there can be an event that it's free food for the employees, it can be a philanthropic donation from the government if it's through a nonprofit to provide the trainings potentially. And then you can facilitate some of that. I think that that's a beautiful idea. And one of those, a lot of times, I don't think that I've ever thought of grocery store employees, but I see them at least twice a week. And so I think that that's true of so many communities. And then see a note in the chat about the importance of hope, healthy outcomes from positive experiences, the work from Tufts, which I just wanted to uplift as well. And then our federal work is under attack as well. We developed a collective impact model 2 years ago, so we can continue trauma-informed work as a collaborative of individual organizations. That's beautiful. I think that that's great, Lisa, planning for sustainability, right? And appreciate that. And then it looks like the chat between the two. I won't continue to read that out for the group. For the ideal agenda, I know that we've been together for a long time and appreciate the thoughts and the energy that you all bring. We've got 5 minutes until 3:30. It's never a bad thing to get extra time back in your day. But are there other thoughts that anybody wants to share for the purposes of this call in developing an ideal agenda? And if something else comes to you or you want to share otherwise, please feel free to email me or any member of the team, jesse@ctipp.org, for any other member of the team, first name at ctipp.org. I was always taught to count to 10 before, just in case anybody had. I just want to say thank you all. It's been challenging, you know, to say the least at times. And being together as a group, hearing these ideas, really rejuvenated me. And I hope the true is the same for you. Our next CTIPP CAN call, we will send an email with the exact specifics of what we will be discussing, but we're getting a lot out of these group discussions and co-creating. And CTIPP has been working on values statement for our organization, which again, we hope serves as a catalyst for the movement. And so I think that there's a chance that members of our board will share about what they have, kind of the process that they've been undertaking for the last couple of years on that, and then getting feedback on what was nothing's arrived set in stone. So we want feedback on, are we on the right track? How do you see this applied as we continue to move forward on that process? With that, sending my love, all of our love to all of you. We look forward to seeing you again soon. If there's anything that we can do, please don't hesitate to reach out. And thank you for the work you do. And we're gonna keep building this movement together. I really believe that. Appreciate y'all.
Thank you for all the information.
Thank you.